Dr. Joyce Okagwa Menopause 2.0, because I was here last year and we're pulling it. So anytime they call me, I don't hesitate, whatever it is, because I'm high on making sure that we support ourselves as women, okay? And before I start to say anything, I would say something to all of us. Women, we are at the stage, this is the stage where we need all the support we can get. And we need to rebuild our confidence. And it starts from saying, I know I have something is not right with me and I need help. Okay, we're at the era where sometimes people speak out and it looks like, oh, if you say your problem, they're going to use it against you. Oh, this one, that one, you need to package. You need to look a certain way, you need to behave a certain way. Please, let's change that mindset. Like Auntie Hilda said, we don't have that time anymore to try to be what we are not programmed to be. And at this stage where we're talking about, my dear, you can have all 4 seasons in 1 second, okay? You can walk in here and then you're just, in fact, I just see maize and I'm just irritable. And I'm like, which one, where is Auntie? You're just beefing for no reason. Please, let's always remember that some of the things that happen to us at these stages in our lives, we don't have that much control over it. But in as much as we are making excuses for the hormones, please let's try to manage ourselves. And that's why we are here, okay? When you have knowledge, knowledge is power, all right? I don't want us leaving this place and we're all grumpy. We know the hormones make us grumpy. And we've heard from Dr. J that, oh, the hormones will make us grumpy. We've heard from Auntie Linda, Auntie Hilda, that the hormones will give us a certain kind of smell. Don't go out of here not smelling good. Come on, you got knowledge. You got knowledge to know that you're going to be feeling a certain way. So you're going to be in charge. The essence of this, ladies, is for us to take charge of that which we cannot control because we have knowledge. That's it. So at the end of this training, I expect most of us to be able to understand. I'm coming from the medical point. Experience is the best teacher. Everything Auntie Hilda was saying, I was just laughing. I was like, Auntie Hilda is like, she's talking about me. Somebody told her, you know when you don't say your problem every year, you say, be like, say, they don't gossip me. Who knows who has gossiped me and got to tell Auntie Hilda. I'm Harcourt. I switch on. When you said that yesterday, I was laughing. My room is like a freezer. I'm like this, bang, 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 bang. Then sometimes I'll go from the switch, off it from the main switch so that the remote doesn't work. I'm crazy when it comes to that. I've just been back. You need to see me. Everybody was covering me. I'm like feeling, I said, God, I didn't have any hot flushes this period because the weather was friendly. Well, once you get into our airport, you know? So yeah. So when I finish, by the time I finish this session, we should be able to understand certain terms. You hear us say things like perimenopause or transition, menopause, and then post-menopause, okay? So I'm coming to tell us what these things mean and what we can do as women, all right? I always tell my story to you guys, those who were there last year. When I started feeling somehow, I thank God I'm not religious, so I know Christ and I know He loves me so much, and I know my village people, they're in trouble. What are you going to do to me? I take care of all the children and I do all these things. If you hit me, you lose. So my village people love me, so it wasn't a village people thing. So I walk up to a friend who is a lawyer, my sister and friend, barrister Eneni Ajayi. And then I'm very open. When it comes to, when you have problems, please always seek help. Yes. But seek help with the right people, okay? Yes. Sometimes we go to the wrong people, and that's why we feel that, oh, they are using against me. They said I'm swelling. This, no. Well, once we go to the right people, then you get support. So I walk up to a sister who is a lawyer. Funny enough, a doctor walks up to a lawyer. That's how confusing it can be. Yeah? The stethoscope, see, at that point, you're with stethoscope. What, you're not diagnosing no shit. I'm a baby girl. I don't have time for feeling grumpy. I still felt young, you know, because you just wake up one day and you're telling you menopause. What is that? Like, baby girl, no. So I had this mindset, man, you know, my life was just starting, life begins at 40. So just when I was getting into 40s, I started feeling something, I was like she said, I carried my bag 6 months, I left the country. I was ready, I was like, I'm tired, this man is, I need a new machine, I need this house over. Ask me what that drama was all about. And I left my husband, I said, I'm traveling, I left my younger sister, please take care of him, be cooking for him. I'm out of this place, I need time. So there was something not right with me in my late 30s, all right, and early 40s. And then I woke up to the lawyer and I said, sis, I went to a shop and we were talking. I've not been serious, I said, my dear, you know, problem everywhere, plenty. I was just talking. She was like, sis, it's like, it's that thing. I said, which thing? That thing. I said, what thing? What thing? I didn't. You see, even though I'm a doctor, we do all these trainings. You don't see yourself as aging. What is that now?
I remember when they used to teach us menopause and these things as a student, I would close my ears. Or even when we go for something, I'm like, how this is.
The journey far.
These old people. And then I woke up one day and here I was. I didn't know. It was like somebody rented my body for free. I didn't get anything. And here I was like, she was like, sis, you feel like saying that thing. I said, which thing? And I was like, no, don't tell me. And then she shared her experience. She had transited very early. Or had 1 or 2 people. So she had, I don't know if you understand.
Yeah.
So I sat down and then I was like, number 1, yeah, number 2, yeah. And by the time I did like 4, 5, 10 symptoms, I fitted in and I was like, So yeah, Auntie Hilda, why I'm saying sharing this again is because Auntie Hilda said, you think that something is chasing you or something is happening to you, people are after you, all right? It can be that confusing, okay? So now when we talk about menopause, most of us just look at menopause as the end or something, a point. No. What happens is long before you go into the menopause, you start behaving funny. And sometimes I say maybe that's why when we get into these late 30s, don't catch this on camera. Maybe that's why the men start doing us, going, because we're a bit funny. You come back home, you're angry for no reason. You're complaining over everything, you're irritable. And then you start hearing, I know for me, I start hearing things like, Jay, you've changed. And I say, you too, you've changed. But then it took me time to understand that I wasn't in control, it was the hormones. All right, so please, let us manage ourselves and know that some of the things, yes, but in as much, remember what I've said, in as much as we are saying is the hormones, please, now that we have information, let's learn to manage these hormones. Are we okay with that? So you hear us say things like menopause, but long before the menopause happens, there's perimenopause. And that's where the wahala starts. Because at that time, you're like, maybe you just finished having your children, you're suddenly having an empty nest, you're beginning to feel yourself, you've been doing all the wifey things, you're just beginning to get your life, and then suddenly something just snaps. And you're like, what is this? I thought they say life begins at 40, I'm supposed to be enjoying now. So you begin to have the changes occur just before you even know you have gone into menopause. And it takes a lot to be able to identify them. And what happens to you? These changes, remember, they start like almost 8 to 10 years before even you transit. And so women earlier, I've spoken to women who in their late 30s, they had started all of that and didn't know they were transiting. All right, for me, I started transiting at 38. Do you understand? So one of the things I noticed was that I started having irregular bleeds. That's the first thing, irregular menstruation. Your cycles just get erratic and all of that. So those are some of the key things that you see it 1 month, you don't see it 2, 3 months, you think you're pregnant 3 months, 3, 4 months like that and all of that, okay? So women start going through all of this. So you can imagine, you know when they say a woman's life is like a flower, now I understand what they used to say. You just have from like 18. In fact, that's why out there, you know, before now, I used to be like, you're too young to have a child. My dear, if my daughter brings a child or anything very young, I'm not going to say anything wrong or anything. That mindset change, because those are the reproductive years. And most times we are busy trying to fit into a script and all of that. And then you wake up one day, you're 35, then you're looking for a man, and then you're looking for a child. And before you know what's happening, all the eggs are finished. So at birth, we are born with, a woman comes with the full package. Okay, you have the full package where once you come at birth, you come in, you're born with a certain number of eggs, about 1 to 3 million, and then you go through those eggs through your life. And by the time you're getting to 35, the eggs that are about 1 to 2 million are less than 80,000. And by the time you get to menopause, you have just like 1,000 remaining. 1,000 is like 41 crates of eggs. You can chop 41 crates of eggs.
Yes, that is 1 month.
So you just have very minimal time. You understand? You would have used up all your eggs. Are we okay with that? So by the time the eggs begin to depreciate, you begin to have those futures. And they come from the fact that as we get older, the estrogen levels drop. The hormones, the estrogen, the progesterone begins to drop as the eggs go down, okay? There's that message sent to the brain and all of that. So we begin to decline estrogen. Everything you see that happens to us is because of those hormones, all right? And then you do that perimenopause, maybe 10, on the average, like maybe in the States, 52 years, here 51, but we're seeing women going into menopause younger. Some of us have gone into menopause at younger ages. As long as you're not under treatment or didn't have surgery or didn't have radiation or anything, it is still natural. Okay, but if you were forced into menopause from maybe illnesses or some of these things, then we'll say it was as a result of other things, okay? So usually now, with advancement and all of that, women are transiting very early and getting into menopause before that 51, but that's on the average, okay? Between 45 to 51, 52, most women would have gone into menopause. So in that perimenopause, you have all the symptoms and Odili that's talked about. Everything, see, this thing, it doesn't joke. From your hair begins to get stained, it begins to fall. Your brain fog is as if they put newspapers, stuffed things in your head. Memory loss, you're looking for your keys, you kept it here. You're like, who stole my keys? The key is there.
You're wearing your glasses.
You're wearing your glasses, you're looking for your glasses.
Oh my God, I'm wearing that glasses. Oh, this is my eyeglass, I'm wearing that eyeglass.
If I finish this lecture and I don't pause, people should give me kudos, okay? You're talking, you're not remembering. Where am I? Where are you? Where are you not? All right? So it starts from your head, everything. Your eyes are dry. Everything dryness, your mouth is dry. I spoke to a lady recently, her lips. I said, nah, the thing, no. Her lips, I said, go and get. I had to invest on moisturizing balms. I didn't used to use them before. See my hands as I was coming in the car. Oye, because my dear, it is dry land. Everything is dry. Up dry, eye dry. Everything. That side, no need. Dry. And yes, everywhere goes dry. Your skin, everything. And then you come down. Okay, you have memory loss. You can't remember anything. Then your mood, your brain, your mood goes gaga. You're anxious. You have panic attacks. You're suspicious. You see women. That's why you see them. Hey, he's cheating. Some of these things, hormonal. They are looking for food. Please, if you're looking for a man's phone, look for money. So that you use it to buy perfume and nice things. Leave the cheating. All right? Yes. Because that's what is happening. And that's why you see, I don't know if you are seeing the rage with which some women, when they get to their late 30s, are following them. You're saying women are doing so many things now to men. I used to say that low-key, these people, is that thing,
menopause.
It's menopause, the transition. They are not able to handle it. You stand in the mirror. When I was transiting, I stood in the mirror and I'm like, Joyce, who is this now? I mean, girl, what is happening? You begin to accumulate weight around your midsection. You don't feel that sexiness again. There's just something that just snaps, okay? But you really need to understand that, listen, this is a physiological process that God himself, if we so believe in God in everything, we say every good and perfect gift comes from God. He knew why he had made it this way. And low-key, off camera, should I? Oh, you're on camera. Women, let me tell you the truth. Women, we were just made, sometimes look at it, it's like, come. Hey, between this, you go and have babies. After that, bam, shut down, move. And that person comes in. We are timed. And that's why it's important that we must understand, especially those of us who are now here and we have girl children, let us understand this timing and minimize these unnecessary expectations that we put on ourselves, so that you finish this journey before, at 35, the eggs have almost, you're finished frying how many? You're born with almost 460,000. Yes, you're frying them all. You've done scrambled eggs, sunny side up and all of that. And you're left, and then you begin to come and worry the doctor, so can I buy eggs? That's what's happening, all right? So during the perimenopause, the problem starts. And at that time, you don't even know, because you're here, you're feeling like Dr. Joyce, I'm a baby girl for life. So it's like, what's this now? What's all this, whatever? But you need this information to know that, yes, the hormones are changing, your body begins to change. You're not able to sleep, you're grumpy. You can't sleep at night. Your mind is racing, you develop panic attacks, you are anxious, your body is shaking, you have electric waves, you have palpitations. Name it, you're gaining weight, you're not eating, you're gaining weight.
You're breathing and whistling.
You're breathing and then you see, if you just enter Mealboss, as I enter Mealboss here and I say, God, the whole of you, Lord, my jet. Before you know what's happening, you just inhale it, bam, 2 kg. I'm telling you, it's just that you're tired. See, my tired is tiring. The degree of fatigue you have, sometimes I'm like, my tiredness can feed the whole Port Harcourt. You are chronically fatigued. You are exhausted. Your hands are shaking. You have tremors. Your joints are aching you. You are bloated. You have indigestion. You have reflux. Name it. Down there is not working. You're like a man. I used to tell myself that there are 2 men in this house. Like, you really need to come out. You're not interested in anything, because you can imagine you haven't slept all night. You're having hot flushes. You're hot, you're cold. You're hot, you're cold. You don't know which one you're doing. Okay? So then you now try to manage to get some sleep at night. You're not thinking of certain things. So it's just a lot happening to one person. Your bones get brittle, all right? And then you manage to do that. Remember, this phase can last for up to, in some women, it can last for up to 5 to 8, 7 years. This transitioning phase. And then you now go, after a while, you just notice that I haven't seen the period though. I haven't seen it for 1 month, 2 months, 3 months, 4 months, 12 months, bam. When once it's 12 months completed, you have gone into what? Menopause. That date, which I know mine, is the only day you say you are in menopause. After that date, you are now what? Post-menopausal. All right? We need to understand this term. So that, yes, because we always say, oh, menopause. No, I am post-menopausal. All right? Auntie Hilda is post-menopausal. Okay, menopause is just that day that that made it 1 year, bam, and then you move into post-menopausal. So those those transition symptoms go into the menopause. So you're menopausal, but at the time when you're seeing, if you haven't seen your period 2 years, 3 years, you are now a post-menopausal woman. Okay, are we okay with it?
Okay, so we that see, seeing our period and see having these symptoms.
Yes, you're a perimenopausal. You haven't done 12 complete months without a period. Yes, so you're still in perimenopause, okay? So by the time you do, are we understanding 12 months, no period? On the date, look, I'm good with my numbers, okay? Please, let's learn something, all right? You see, Auntie Hilda said diary. Keep records. I keep records of my periods and things and reactions. Just have a small notebook, your go-to girl thing. You just go open it. So you check, because at this point, you really need to know when you stopped seeing it. So you can actually tell your doctors, okay, I saw it last so and so day. It's just like you know when you started seeing your period, okay? So for some people, or some of us that maybe started puberty early, I think we went into menopause earlier because I was 8 years. And then my sister who was 16 is still okay, all right? Yes. So yeah, so you go into menopause just that day, that date, 1 year, and then after that time you're what? Post-menopausal, okay? So these perimenopausal symptoms we talked about goes with you into menopause and sometimes into post-menopause. Some women even go through these symptoms almost all their life. Yeah. Some women 5 to 10 years. Some of my friends are lucky. They don't have so many symptoms. So it's an individualistic thing, okay, when it comes to these symptoms. Now, as estrogen drops, estrogen is what protects everything. This brain that we're talking about, that you can't remember anything, it is estrogen. The bladder, you start peeing. I didn't even talk about the urine. If you're pressed now, if there's no toilet near you, don't try not to hold urine too long. Go. You pee on yourself. 40%, 60%, start going. If not, you just, because it is also the estrogen that helps to keep the bladder warm and keeps it clean. So the risk of urinary tract infections are higher. The risk of, once you get urgency, you just want to go. The bladder walls get slightly weak because the elasticity is lost. Your bones is the same estrogen. It's estrogen that gives us this baby girl supple look that we always have. So as it's going, you see everywhere is, getting dry and, a bit. So those are the things. And it's also estrogen that protects the brain. Auntie Hilda was saying it. It's estrogen that protects certain parts of the brain. The hippocampus, the prefrontal complex, and prevents those oxidative stresses that comes. So once it decreases, your risk, that's why women are at higher risk of Alzheimer's, okay? Yes. So as you now begin to lose your cognition, you don't know. You see, sometimes you wonder, what happened to Dr. Joyce? Why is she looking like this today? That's how it is. That's how she woke up. So you begin to lose your memory, you lose your cognitive function, your behavior begins to change because of that decline in estrogen. Estrogen is what
they're not they sell them for markets. No. So, yes, now so we can be pumping ourselves with estrogen.
Now we'll come to that. Okay, so do we now understand this whole thing? Yes. There is no symptom, okay, that doesn't come with this menopause. There's nothing. Everything, And then let me tell you guys something that is very important. When women are younger, our risk for cardiovascular, this is where I am interested in for women, especially for those of us who have encountered me today. You always hear, heart attack, sudden death, women are dying. Your risk for cardiovascular illnesses covers up the risk for men after menopause because estrogen protects the heart. Estrogen was what was helping us, that even though we were eating all this oil and everything, our cholesterol levels were manageable. As soon as you go into menopause, I don't know those of you, if you're checking your blood works, please let's do our blood works. Always do your blood works. For me, just before my birthday, I do that present to myself. I go and run my blood works. And then October is usually cancer month, so you can do your screenings, your cervical, your pap smear, your mammograms and all of that. So in as much as we're working hard and looking good, please let's invest that money as women into our health, especially at this age where we are. Estrogen has done us one chance. We are now managing ourselves. So estrogen protects the heart. Estrogen helps to maintain our cholesterol levels to be stable. When once estrogen goes, you just wake up one day and you'll be like, but my cholesterol has always been good. Your cholesterol begins to rise. And when your cholesterol rises, your risk of atherosclerosis, it leaves plaques in your coronary vessels, and your risk of cardiovascular illness increases. That is one of the major causes of deaths in women, outside the cancers. So let us have that at the back of our minds. Let's not be too casual. You go, you're eating everything, you are not checking, we do, we're eating everything, and we're not checking our numbers. So we must know our numbers when once we are in this transition, menopause, postmenopausal, because our risk for coronary artery disease and other cardiovascular illnesses increases and catches up with what happens with men. Alright? It is still this estrogen that protects the bones, calcium and all of that. That's why you see some of us can't climb stairs, joint pains, everything. Yeah, your knees are going. Estrogen is what lubricates the joints. Estrogen is what keeps everything. Your shoulder, I don't know how many of you have developed a frozen shoulder. I had a frozen shoulder 18 months, I couldn't wear a bra. I woke up one morning and one shoulder was gone. 18 months I had to do physio. Frozen shoulder. There's something we call the musculoskeletal syndrome of menopause. So it's a lot. But now that we know, it means that we have our numbers in check and we're talking to somebody, we're talking to our doctors and we're getting support. We are not just sitting there and saying, it's because of that onunu I chopped yesterday. It's because of this. Don't because of anything. You must know your numbers, because as you get into menopause, your sins of your young ages, your risk factors catch up with you.
Yeah.
Smoking, alcohol, all the things we did catches up with you, all right? And then they increase your risk for all these cardiovascular illnesses. Are we okay with that? Yeah. So what are the things that we should be worried about that have come to talk to us now? You hear me saying the hormones are down, the hormones are down. What can we do as women? I think that should be what you guys want to hear from me. What can we do? And Hilda was asking, they sell this hormone, this for market. Now, okay, there are so many things we do for women who are in menopause. You can see the problems are a lot. And you can imagine most of us are professionals. Both at home, you're a professional housewife, professional chef, professional day minder, because if you have children, you're caring. So we are professionals in any way you look at it. At work, you're expect, and then remember, this is still the age where women are achieving a lot.
Yeah.
Sometimes I'm like, then you can't put on the TV and you're seeing someone like Ngozi Okonjo-Iweala. You're seeing someone like Auntie Hilda. I'm like, these women. I put on my shoes. I say, I must continue this race. I must catch it. How are these women doing? Loki. I'm like, these women, don't you? I was asking one of my profs the other day. I'm like, how are you guys doing this thing? Like, it can be overwhelming. But when you see the women like Auntie Hilda, please draw strength from their wealth of experience and from the fact that they turn up all the time. So we don't have a choice. We have to stay in the race. And we will run it. And we will win it.
That's
but
right.
Whilst we are running it, what do we do as women? We have different ways with which we manage the menopause. You can hear all the symptoms I've told you. There's hormone replacement. There's some women that receive hormone replacement. You know the white women, they don't like all the...
They don't like stress.
They just go and get it. They put them on hormone therapy. So we have hormone therapy, we have hormone replacement therapies. So we have the pharmacological, that is the drugs, and then the non-pharmacological. That's where all these lifestyle things that Hilda talked about. Now, some women would benefit from hormone replacement therapy because the symptoms can be overwhelming and it impairs. See, the quality of your life is impaired, whether we like it or not. Sometimes I wonder, this menopause, God, why? Why do women have to go through all of this? But who are we to question? It's a physiological thing. It will come and go. It's a phase, so we're supposed to learn how to manage ourselves. So some women are candidates for hormone replacement. Those women who maybe they don't have a uterus, okay, because by the time you're giving estrogen, your risk of cancers are very high. So, but there are some women that maybe they would have had a hysterectomy earlier or something. They may be risk. So when it comes to therapy, it is individualized. Your doctor would have to assess your risk factors. If you have a family history of maybe previous strokes, or you've suffered a breast cancer before, or you had radiation therapy for something, we don't want to do that. Okay, so you may not be a candidate for hormone replacement therapy. And once you're on hormone replacement therapy, the side effects, there's so many parameters they need to monitor. Your risk of thromboembolism is high, deep vein thrombosis, a lot of things, stroke and all of that, and the cancers. Okay, so when it comes to treatment, the doctors will always select you individually to see what works for you, okay, and where you fit in. They will assess your risk factors, your family history, and all the other things, okay? In this part of the world, you know, we are not really, very few women are on hormone therapy, all right? Because maybe our mothers, like you said, they were doing all those things. Our mothers learned to endure. I don't know how they do it and how they did it. I say it when I go to the villages, I look at these women, I'm like, I was talking to her today and she was like, Joy, don't worry, it will come and pass. I said, but it's not passing. It has come, but it doesn't want to pass. You know, so you find out that, and with all these problems, you know, people, they have, the healthcare is good, they can monitor clots and all those things, interventions. Here, our healthcare is good, but our health-seeking behavior is not so good, because the first thing is to say, hey, somebody, my neighbor said yesterday will kill me. This one, we are a bit myopic when it comes to health-seeking behavior. So it will be safer if we, as women, we can get alternative methods to manage these stresses. And what do? We have the symptoms: hot flushes, cold flushes. You heard what Auntie Hilda said. Make sure you're wearing clothes that are comfortable, okay? All right? You're traveling, so I'm traveling, I'm wearing a t-shirt inside, a light t-shirt. Then I'm wearing this one on top, and I'm wearing something warm. Along the line in the plane, you saw me, I went to the toilet, I removed this one, I left the other one. I went back, I removed the trouser, another one inside. You will just be doing like this. I had the duvet. I came with the duvet. I had another jacket, okay? I had a hat. So you're doing things, you make sure that you're well equipped to manage those stresses. At night, you're wearing very light cotton clothes. Keep your room cool, okay? If you're fortunate enough to have light, power, I pray for all of us, okay? Make sure that your room is kept cool. Make sure you practice things like yoga, meditation, read a book, relaxation techniques. Don't go and put yourself where they didn't put you. Manage your stresses. Because menopause and stress, they don't go together. If you see the way I run away from problem now, I fly out of the window. If we are here now, and problem comes, you just see, only me will just leave this window. I don't know how it's going to happen. The window will open. Because you are already in a pressure. You are permanently stressed. So you're trying to manage your stresses, okay? So exercise, all right? Risk little, start little, support yourself. Strength training is very important, because remember I said estrogen and the bones and calcium. We need to strengthen our bones. So that's why women just have fractures. You know those days, you just hear, she fell, she broke her hip and all of that because of osteoporosis, osteopenia, okay? So make sure you're lifting weights. And it doesn't have to be too whatever. Carry sand, put in one bottle of whatever, and improvise at home. You know, and then do your strength trainings and lifts and all of that. Are we okay with that? Pelvic floor exercises too, to strengthen your pelvic muscles, all right? Yoga for your mind, meditation, read a book just before you go to bed. Screen time, if you're having problems with sleeping, put your phones, these new phones have these parameters that help you to say, okay, lock you out. Okay, you can set your screen time and all of that, all right? So you can do these relaxation techniques. Then there are other foods that have phytoestrogens, okay? There are certain foods that have like estrogen components, yes. Things like soya beans, our regular beans, these are honey beans, flax seeds, you know, and lentils, certain lentils, grains, leafy green vegetables and all of that. Manage your weight, all right? We have to learn to manage our weight, modify our diet. See your doctors, all right? Make sure you have this health-seeking behavior. Know your numbers. You want to know your blood sugar levels. You want to know your cholesterol levels. You want to see what is happening to you from time to time because of this increased risk. You may be low in certain micronutrients and certain vitamins too. Vitamin B12, you know, calcium, vitamin D, and all of that. Do your screenings, iron, because your body is in a high metabolic demand rate, okay? So you will need to supplement these things, all right? So these are some of the things we can do, all right? And then you like maybe things like poor sleep. There's some herbs, some teas that also help, chamomile teas and all of that, okay? There's some things that can actually support us too, all right? And then if you go to the pharmacies, you see certain supplements too that have certain things like sage, courage, that help to prevent these hot flushes that women have. Alright, so there are little things we can do in our own environment. Of course, cognitive behavioral therapy too. get psychotherapy, get support groups. That's what we're doing now. All right, this is what we're doing now is support. All right, EPP supports women to create that awareness, you know, to manage menopause. So we get the support group. Talk to somebody. Don't let it get too overwhelming. Sometimes we've had to give antidepressants. All right. Yes. And sometimes we've had to use certain drugs that we use, some certain seizure medications. So women can have terrible hot flushes. They are dripping. It's all of that. We've had to use certain drugs to manage those symptoms that they have. Okay. So they have poor sleep. We give them something. They are depressed. Women get into depression. This is the time when women get into depression, anxiety, and if it's not well controlled, they lose a part of them. All right. So you can imagine not sleeping, having hot flushes, being restless, your joints are paining you, you're forgetting, you're not delivering at work, it's just overwhelming. And if you're not careful, you'll be like, why me, why me, why me? Before you know what's happening, you're talking to yourself, why me, why me? You're on the street, oh, why me, why me? You're pulling clothes, why me, you know? So yeah, so it's very easy to snap and to cross the line. So going forward as women, all right, we need to understand that I needed to get to terms with that stage, because even though I am a medical doctor, it was hard. When you hear these things, you expect it to be very far from you, all right? So we need to come to terms with the fact that it's a physiological process. It is something that God has done. It's a transition. As women, we should be bold enough, we should be resilient enough to go through this phase without losing ourselves. We should learn to seek help, genuine help. We should learn to speak out, okay? It's not, you're not the cause of your problem. The hormones are not being kind to us. And here it's cool because so many women didn't even live to go through this phase to know what it felt like. So I think aging is supposed to also be a blessing that, oh yeah, I'm cool now. And I tell people, listen, I'm not your mate, I'm postmenopausal. So it's a bragging right too, you understand? I'm like, I'm a big girl, this small girl, people should stay there. Do you know what it is to be in menopause? All right, so you find ways to manage it, make fun and love the process. And yeah, some days when it's really bad, okay? Yes. But hey, let's not let things just go like that. Let's watch what we're eating. Let's manage our weight. Let's manage our stresses. Let's go out. Let's have support groups, okay? Let's have support groups. Let's have fun times. Do what you love to do. Get distractions. When the symptoms come in a little that much, just wake up and say, oh, these things are here. Manage it, okay? Get some form of distractions, do what you know how to do, learn something new, keep your brain reading, make sure you sharpen your brain, get omegas, the fish oils and all of that, protect your brain health. Make sure your hygiene is also okay. You remember I said a lot of urinary tract infections may come in at this stage. So you're drinking, you're hydrating, very important. Hydrating, keeping the hygiene, keeping your mind clear. The stresses will come, but please pick your stresses wisely, all right? And let the people around you know. My children know, Mom, is it that thing? I say, yes, it's that thing. So sometimes, even when it's not that thing, I'm tired. Mommy, oh, you know, Mommy, is that menopause? I say, yes, it is. Please, it's that thing. Okay, and sometimes I want to be funny. I'm funny. I know I've snooped, I've goofed. Hey, Ken, you don't hear this on camera, okay? And I'm like, hey, oh, boy, sure you know that this menopause is stressing me. Say, everything is menopause, Because I know I've goofed. Okay, I want this water. I say, well, this menopause is not easy. This is aquafina that I want. You run and go buy it. It's also helping in any which way, okay? So yeah, so let people know that this is what you're going through. I don't think it's a thing of shame. I'm a doctor. No. I'm here. I'm saying it. Find out what other people are doing. What works? Sometimes it's just somebody may just say something and it just works. I say, okay, this is it. Okay? Incorporate some flax seeds. I do my yogurt, okay, my Greek yogurt. I put in some flax seeds. I put in some cinnamon. Cinnamon helps to lower your blood sugar because as you age, your blood sugar starts climbing. Your cholesterol starts to climb. Your blood sugar goes with it. And you're like, what's happening? The hormones have gone gaga. Estrogen is gone. Estrogen protects, does all these nice, juicy things, okay? So make sure that you're reading too, you're researching, and you can join groups. There's so many groups, even on the social media. Women come out. If I joined one group, this white women, I was like, God, see me complaining. My own is learning work. You hear all sort of things, creepy, crawly things on their skin. Their bodies are smelling. Please let us not smell yet, oh. And we don't all have to smell, all right? Okay. Let us look for hypoallergenic short things like, you know, there are so many things on the internet. Oh, if you use this, you have cancer. If you use it, you have cancer. You don't use it, you have cancer. You don't want to be smelling. I have like 2-3 perfumes in the car. I put a little here. As I was coming down, a little here, a little here. Okay, you don't want to have that odor because once it comes, it stays. And you're like, remember, with menopause, you're more sensitive. They don't need sniff dogs at the airport. They just need to call me to come there. I'll sniff drug or anything. Your nostrils, you're more sensitive to every smell. So imagine you already have that sensitivity, then you'll now be smelling yourself again. So if you maintain that whatever, you chase it out. Most women, it's not every woman that smells. You don't need to smell. Alright, you can manage those things. So please, let's manage our stresses. Good sleep hygiene is very important. If you're not sleeping, you can't lose weight. If you're not sleeping, you cannot, your mental health, you're messed up. If you're not sleeping, you can't do anything. You go into depression. You're perpetually in worry. Sleep is very important at this age. Alright, for menopausal women, we must find a way. It is difficult. It is difficult. You will go through the insomnia, but please find ways, alright, to help you. Make sure that your room is cool. You're getting, you're eating nutritious vegetables. You're getting things that help with your sleep health. It's very important, okay? Your joints, your bones and all of that, your vitamin D levels, your calcium levels and all of that, okay? You're moving. Movement is very important in menopause. You must keep moving. Every movement is very important. No matter how little, make sure it's regular. You don't need to do anything too over the board and all of that. Just make sure you set your timer or your watch. Every day you put in your 30 minutes, 45 minutes or more. You can just be in the house, cleaning the house, moving around and all of that. It also helps with your bones, it helps with your mind. Exercise gives you those happy hormones that makes you feel good, okay? And find ways to manage yourself, okay? If you like to look a certain way, if you like the shopping, there are so many things that reduces stress. If there's a lot now, menopausal symptoms don't go. If I go shopping, I know where my destiny is. So once you're feeling low mood, sometimes you see me in the mall, know that the thing has started. I'm in the shop. Once I buy one perfume, even if it's 2K, my dear, that day is settled. I'm feeling good. I don't know if you understand. So please wake up, dress up, turn up, look nice. You are not because of hormonal whatever. You are not the problem that the hormones, yes. So you manage yourself. You don't need to wait. Okay, if I'm not telling anybody, I'm sure you don't even know that it's hard. It's the thing. You still be packaging and be doing so that you're giving. Remember, by turning up every day and doing what we are talking about, what Hilda has said, you're giving strength to the younger girls.
Yes.
Who are coming. So every day we do things right and we manage ourselves. We give hope to the younger people, okay? A lady walked up to me and was crying. I want to be like you. Nothing is wrong with you. I said, Dolly, this one knows that I carry 99.99% of symptoms on my head and I'm moving around. So I allowed that. But here I felt good. It meant that I carried it well. All right? So that's what I want us to do as women. Please, let's carry it well. Let's manage our stresses. Let's manage our emotions. Let us know that the hormones will make us to be a bit grumpy, but please don't run with that. Don't go fighting maize, EPP. Well, we come here to enjoy. Don't go and be saying that which kind of glasses this one, this Dr. J, 2.0, Well, once you're getting a bit funny, just tell yourself, is that in me? Please calm down. I talk to myself, I'm like, Jay, calm down. Take deep breaths, rest, turn up later. There's something happened yesterday, and somebody called me. Like Auntie Hilda said, I said, how is this somebody's bicycle or someone's palm tree? That I said, how does it concern me? I took deep breaths, I off the phone, and I called back later when I was a bit concerned.
Exactly.
Because I was like, what is this? So you must learn how to manage yourself in the midst of the chaos that we go through. Because once you wake up in the morning, it starts ticking. And the hormones are also ticking on you. So please make sure you're doing everything right. And hey, I'm always here to support you guys. Thank you so much for having me.